As of December 2013, there are approximately 28,000 North Carolina residents that are living infected with human immunodeficiency virus, or HIV. In North Carolina, the number of newly diagnosed HIV infections per year is increasing once again. This disease, followed by the onset of acquired immunodeficiency syndrome, or AIDS, has been prevalent in North Carolina since the first diagnosis of AIDS in the state in 1982. From that time, the rate of infection, based on first-time diagnosis, regardless of stage of infection, has continued to increase. This consistent increase of infection could be influenced by many factors. This can be attributed to the lack of education available to rural and socioeconomically less fortunate areas of North Carolina, social stigma surrounding HIV and AIDS, and the lack of financial means to pay for medication and treatment. Throughout North Carolina, there is a lack of education available to laymen in regards to the HIV/AIDS infection. There are also social stigmas that surround reporting HIV/AIDS symptoms and confirmed infections. Also, an argument can be formed based on the $46,693 median income of North Carolina, which is substantially lower than the national median income. It can be concluded from this information that it is also much harder for HIV/AIDS infected North Carolinians to afford medication or treatment for their infection. As the public health major on a physician assistant's track for undergraduate studies at Elon University, I have sufficient experience in researching this type of information. Through conducting extensive research on this topic, I feel confident in creating solutions for the problems relating to HIV/AIDS in North Carolina. The HIV/AIDS pandemic is believed to begin in Africa in the early 1920s. However, it became a diagnosable disease in the United States in the 1980s. It was commonly diagnosed in those with hemophilia, a blood clotting disorder, in homosexual men, and injecting drug users. That demographic has not changed very much over the past 30 years, but has grown to include other populations of people. For example, heterosexual women, heterosexual men, and children. In North Carolina, the first reported incidence of HIV/AIDS was reported in 1982. And though the mortality rate of HIV/AIDS infected persons has remained stable, with small decreases, the infection rates continue to rise. This is due to transmission during unprotected sexual intercourse, intravenous drug use, and in some cases it can be passed on to an innocent infant while the mother gives birth. The tragic contraction of HIV/AIDS can be a lifelong struggle for some children. The number of incidences of HIV/AIDS in North Carolina can be greatly reduced by increasing educational tools in rural and socioeconomically less fortunate regions of the state, providing more support for those infected by HIV/AIDS, those who treat them, and those who may come in contact with HIV/AIDS infected persons, as well as utilizing government regulation to normalize medication and treatment prices for those who do not have insurance or whose insurance imposes astronomical copayments. Utilizing North Carolina public school system can target the solution, increasing educational tools to teach adolescents the importance of protecting your body from HIV/AIDS infection, as well as how to do so. With the imminent repeal of the Affordable Care Act under the next President of the United States, it will be more financially feasible to provide access to support groups and make treatment and medication more affordable to HIV/AIDS infected residents of North Carolina, in addition to some of the already active prescription assistance programs in the state. The rate of North Carolina residents that are diagnosed with HIV/AIDS in rural, typically more southern areas is much higher than that of northern, more urban regions of North Carolina. This can be attributed to many factors, but the most prevalent would be the lack of adequate information regarding HIV/AIDS available to those in these rural areas. Amending the Healthy Youth Act that is practiced in North Carolina can solve this problem. Targeting specific items within the state's General Assembly bill will allow for more thorough coverage regarding this deficiency in education. The most concerning portion of the bill is Section 4, Part E. This portion of the bill reads that sexuality education must teach that a mutually faithful, monogamous, heterosexual relationship in the context of marriage is the best lifelong means of avoiding sexually transmitted diseases, including HIV/AIDS. This exclusion of the LGBTQ community in this bill is glaring. For young students who may be questioning their sexual identity, this failure to include the LGBTQ community is apparent, insensitive, and does not allow for wide application or interpretation of the bill. This portion could be changed to instead read, Sexuality education must teach that a mutually faithful, monogamous relationship in the context of marriage is the best lifelong means of avoiding sexually transmitted diseases, including HIV/AIDS. The omission of the word heterosexual would open up the application of the bill to more than just heterosexual adolescents, which could change the way that knowledge is practically applied to their everyday lives. Social stigmas and consequences surrounding these stigmas can be detrimental to the process of seeking treatment for HIV/AIDS. Stigmas surrounding the infection include personal irresponsibility, like infidelity or promiscuity, drug use, fear of transmission, and imminent death of the person who is infected. The consequences of these stigmas can also include loss of job and therefore source of income, loss of reputation, and limits the quality of health insurance that is available to the infected person. With all these factors considered, infected people may find it more beneficial to hide their infection than seek treatment. This hesitation in seeking treatment can allow HIV/AIDS to progress faster and become more dangerous to the infected person. Removing these stigmas will break down barriers between the patient and potential treatment. With the help of government sexuality education programs, counseling services, and sensitivity training for medical professionals, the stigmas associated with HIV/AIDS can be greatly reduced. In addition, the consequences of such stigmas can be obsolete if the stigmas do not exist. The price of medication, specifically medications that treat HIV/AIDS, has skyrocketed over the past decade. At this point in time, it can be estimated that a lifetime of treatment for HIV/AIDS costs $500,000. To put this amount into a more precise time period, it can cost up to $5,000 a month to treat HIV/AIDS with simple medications. Very often, it is impossible to find cheaper medications because no generic brands are available. This allows no alternative options for less financially stable people. North Carolina has the North Carolina Drug Card Program that qualifies as prescription assistance programs. According to NorthCarolinaDrugCard.com, the coupons that are provided can take up to 75% off certain medications at certain locations. However, after contacting many Alamance County pharmacies, these coupons do not affect the prices of HIV/AIDS medications very significantly, approximately $5 to $10 off the initial price. This program must expand with the increasing prices of medications to treat this infection. According to the Washington Post, there is a 4,000% increase on a drug that's purpose is to treat life-threatening infections in immune-compromised people, including those with HIV/AIDS. When one pill costs $750 and there is a long road of treatment ahead, the expansion and updating of the coupon scope would be invaluable. There are arguments that abstinence-only education should be the only type of sexuality education throughout North Carolina. It can be argued that it is the only way to prevent contraction of STIs, specifically HIV/AIDS. The advocates for youth define abstinence-only education as teaching abstinence as the only morally correct option of sexual expression for teenagers. They usually censor information about contraception and condoms for the prevention of sexually transmitted diseases and unintended pregnancy. This type of education statistically does not reduce sexual activity before marriage or a monogamous relationship. Therefore, it does not reduce the rate of HIV/AIDS occurrences whatsoever. In comparison to programs that acknowledge sexual activity before marriage or a monogamous relationship, abstinence-only programs are highly ineffective. The expansion of North Carolina drug card usage and acceptance may not stimulate the economy of the nation or provide increased profit for drug-producing companies. However, the drawing back of HIV/AIDS medication prices would stimulate the economy of the state. This stimulation is possible due to an excess of money being available for spending within the state instead of being spent on HIV/AIDS medication that are ridiculously overpriced. In North Carolina, the number of HIV/AIDS cases per year is increasing due to a lack of education available to rural and socio-economically less fortunate areas of North Carolina, social stigma surrounding HIV/AIDS, and the lack of financial means to pay for medication and treatment. These problems can be solved by amending the Healthy Youth Act to expand including the LGBTQ community, providing support for those with HIV/AIDS, those who treat them, and those who may come in contact with them, and expanding the North Carolina Drug Card Program to cover the ever-rising prices of HIV/AIDS medications. The spread of HIV/AIDS pandemic is slowing but has not come to a halt. It is impossible to expect a complete end to a problem overnight. To solve this overwhelming issue, we must all work tirelessly to implement the solutions outlined in this essay. To improve and amend the Healthy Youth Act, you can contact your North Carolina General Assembly representatives. You can find this information for your area at the North Carolina General Assembly Who Represents Me page. In order to promote government sexuality education programs, counseling services, and sensitivity training for medical professionals in regards to HIV/AIDS, it is imperative that you again contact your General Assembly representatives. To affect HIV/AIDS medication prices, promote the use of the North Carolina Drug Card and contact the customer service representatives at the North Carolina Drug Card Association to request an expansion on coupon usage. The HIV/AIDS pandemic is a large problem in North Carolina and is rapidly spreading and becoming more and more prevalent through southern counties in the state. It is important that we act now to prevent the rampant spread of HIV/AIDS, or it will reach closer to our lives and begin affecting those close to us.